The Universal Newborn Hearing Screening Program, or UNHS, is a preventive public health initiative designed to protect hearing loss in newborns. This program ensures that infants with congenital hearing impairment are identified before speech develops, allowing early intervention that supports normal language, learning, and communication. As nurses, we play a crucial role in promoting early screening, educating parents, and coordinating follow ups for these newborns. The Universal Newborn Hearing Screening Program is a preventive program to detect congenital hearing loss. This is very important to be conducted before speech develops. Thus, support or supportive intervention could be given for normal language development. The UNHS was established under Republic Act 9709, known as the Universal Newborn Hearing Screening and Intervention Act of 2009. This law requires all newborns to undergo hearing screening before leaving a health facility. It also mandates the Department of Health and accredited hospitals, birthing centers, and midwives to ensure that proper testing is available and accessible. This makes hearing screening a mandatory part of newborn care, just as important as vaccination or newborn screening. The UNHS has three main objectives. First is to detect congenital hearing loss as early as possible, ideally at birth. Second is to enable prompt diagnosis and management, ensuring that treatment begins during the most critical stage of brain and speech development. Third is to prevent delays in speech, language, and cognitive growth that can lead to social and emotional difficulties later in life. Let us remember that early detection means early opportunity for normal development. This program covers all newborns, regardless of where they are born, in the hospital, birthing clinic, or even home deliveries. Screening should be done before discharge, with special attention to high risk infants, such as those born prematurely. those with family history of hearing loss, or those exposed to infections during pregnancy. The goal is to ensure no newborn is left unscreened because every baby deserves the opportunity to hear and communicate. The first 6 months of life are a golden period for language and speech development. Detecting hearing loss during this window allows early intervention that helps children communicate, socialize, and learn effectively. Without screening, many children with hearing impairment are diagnosed only after they fail to develop speech, when treatment outcomes are already limited. Early detection prevents not only developmental delay, but also the emotional and social challenges that may follow. The tests used in the newborn hearing screening include the acoustic emission or the automated ABR or auditory brainstem response. This technology and this procedure are simple and non invasive and done while the baby is asleep or calm. The entire procedure takes just a few minutes to complete. Nurses assist by preparing the baby, calming the parents, and documenting results. Timing matters in hearing screening. The test should be done before hospital discharge. If that is not possible, it must be performed within 1 month after birth. Babies who fail the initial screening should undergo early rescreening for confirmation. The earlier the test, the sooner intervention can start, and the greater the chance for the child to develop normal language skills. The autoacoustic emission test measures the echo response of the cochlea, the inner ear, when stimulated by sound. It shows how well the ear is functioning and reacting to sound waves. This is usually the first line test for most newborns because it is quick, affordable, and reliable for detecting hearing issues in the ear canal or middle ear. The automated auditory brainstem response is a test that measures how the brain responds to sound using small sensors attached to the baby's scalp and ears. It is primarily used for high risk infants or those who stayed in the NICU or the neonatal intensive care unit. The test confirms whether sound signals travel normally from the ear to the brain. It is especially important in detecting neural hearing problems that may not appear on a standard OAE test. The hearing screening can have three outcomes. First is pass, meaning hearing is within normal limits. No further testing is needed. Another result is the refer. The baby requires rescreening or confirmatory evaluation to verify results. The third is fail. This indicates confirmed hearing loss, and the baby must be referred to an ENT specialist or audiologist immediately. Nurses play a key role in explaining results clearly and reassuring parents throughout the process. If a baby fails rescreening, a confirmatory test is performed by a specialist. The child is referred to an ENT doctor or audiologist for a full diagnostic evaluation. If hearing loss is confirmed, the baby may be fitted with hearing aids or enrolled in therapy right away. Early diagnosis ensures that intervention begins before the critical 6-month mark. Intervention doesn't end with the diagnosis. Management includes speech and language therapy, family counseling, and regular follow ups to track progress. Research shows that early intervention, ideally before the 6 month of age, significantly improves language, social, and cognitive outcomes. Nurses act as coordinators, helping families navigate referrals and follow up appointments. Nurses are at the heart of the UNHS program. Our roles include educating parents about the value of hearing screening and early intervention, assisting in the screening procedure and ensuring accurate documentation, and coordinating referrals and follow up visits for babies needing further care. Our goal is to bridge families and the health system so that every newborn receives complete and timely screening. Nurses also have ethical and legal responsibilities under RA 9709. First is to obtain informed consent from parents before the screening. Next, maintain privacy and accuracy of results in line with data protection standards. Third is to follow all DOH guidelines and institutional protocols for testing, documentation, and reporting. By upholding these principles, we protect both the child's right and the credibility of our profession. The program is jointly implemented by the Department of Health and the PNEI, or the Philippine National Ear Institute. These agencies collaborate with accredited hospitals, birthing centers, local government units, and non governmental organizations. Their goal is to strengthen outreach programs so that even babies in remote communities have access to hearing screening services. So, how do we know the program is working? Success indicators include increased number of babies screened and treated early, improved language and learning outcomes, and a strengthened referral and follow up network across health facilities. These indicators reflect progress toward the national goal of early detection and equal access to care. Despite its success, the UNHS still faces barriers. Number one is the limited equipment in rural and the UUAs. There's also shortage of trained personnel to perform and interpret hearing tests. And there is low awareness among some parents and health workers about the importance of screening. Addressing these challenges require continuous training, resource mobilization, and strong advocacy from all health professionals, especially nurses. In summary, the universal newborn hearing screening ensures early detection and management of hearing loss in infants. Nurses play essential roles in education, screening assistance, documentation, and referral coordination. Early intervention enables every child to develop normal speech, communication, and learning skills. That is helping them reach their full potential.